Ligaments are a specific type of structure which are very important for any joint because they are responsible for the static stability of a joint. And the movement of joints of no use if there is no stability, because in that sense that movement can be more harmful than good without the stability that can lead to subluxation or dislocation of the joint. That brings us to the stability of the hip joint, because that's what we are talking about. And the ligaments that are responsible for the static stability of the hip joint are the most important three ligaments, which is the iliofemoral ligament, ischiofemoral ligament, and the pubofemoral ligament that we are going to talk about in this lecture. We're also going to talk about the transverse ligament and the ligamentum teres. So, as I already mentioned, there are three major ligaments, and these ligaments actually reinforce the hip joint capsule. So two of them are located anteriorly and one is located posteriorly. So if we take a look at this picture here, we can see a Y-shaped ligament, which is known as the iliofemoral ligament, also known as one of the most important ligaments of the hip joint. The second is the pubofemoral ligament, which is present beneath the iliofemoral ligament right here. If we take a look at the posterior aspect, here we can see that this is the ischiofemoral ligament, and just superior to the ischiofemoral ligament, we can see that here we have the iliofemoral ligament as well. So let's take a look at all of them in detail one by one. So let's start off with the iliofemoral ligament. Iliofemoral ligament in some textbooks is also known as ligament of Bigelow, and this ligament is located anteriorly, and it also reinforces the capsule anteriorly, as well as you can see in this picture it is superior to the pubofemoral or superficial to the pubofemoral ligament, and it reinforces the capsule interiorly. It attaches to the proximally to the anterior inferior iliac spine and crosses the joint anteriorly, and then it splits into two distal parts, and which gives it a Y shape, and then it attaches to the intratrochanteric line of the femur, which is a line connecting the greater trochanter and the lesser trochanter, and that is why it resembles the shape of an inverted Y. Here it is actually originating from the anterior inferior iliac spine and then taking an inverted Y shape and attaching to the intratrochanteric line. Here is the greater trochanter and here is the lesser trochanter. It is often referred to as the Y ligament because of its shape, in addition to its other names, namely the iliofemoral ligament and the ligament of Bigelow. Its main function is actually to limit the hyperextension of the hip joint. The other ligament, which is also located anteriorly and is very important for the stability of the hip joint, is the pubofemoral ligament, but it is slightly deeper to the iliofemoral ligament. It spans the hip joint medially and inferiorly, and it attaches from the medial part of the acetabular rim and superior ramus of the pubis, as we already mentioned in previous series of lectures that there are two rami of the pubis. One is the superior ramus and one is the inferior ramus. So this is here is the body, and this is the superior ramus, and here we will have the acetabulum. So it is attaching proximally to the medial part of the acetabular rim as well as the superior ramus of the pubis. Moreover, it runs down and back to attach on the neck of the femur. In its function, it limits hyperextension just similar to the iliofemoral ligament, but it also limits abduction. Last but not the least is the ischiofemoral ligament, which is the one of the three ligaments of the hip joint, and it covers the capsule posteriorly, as I already mentioned. So here you can see here in this picture as well. So this is the posterior aspect, and it is actually covering or reinforcing the joint capsule posteriorly. It attaches on the ischial portion of the acetabulum on the posterior aspect, and as the ischium bone itself is located posteriorly, so that's how it attaches to the ischial portion of the acetabulum. Now, and it crosses the joint into a lateral and superior direction, so it moves laterally, which means outwards, and superiorly, that is in upward direction, and it attaches on the femoral neck just like the pubofemoral ligament, but that was located on the anterior aspect. The function of the ischiofemoral ligament is that it also limits hyperextension similar to the iliofemoral and pubofemoral ligament, but it also limits medial rotation. Now, talking about the functional anatomy of the hip joint ligaments, these three ligaments all attach along the rim of the acetabulum and cross the hip joint in a spiral fashion to attach on the femoral neck. Now, these cross in a spiral fashion because of the rotation of the lower extremities during the embryonic development. Now, to limit the motion in one direction, which is the hyperextension, and that is the common function of all of these three ligaments, that is the iliofemoral, ischiofemoral, and pubofemoral ligament, which allows full motion of flexion to the hip joint, but it limits the movement in extension or hyperextension. Now, moving on, if we talk about another ligament which is known as the ligamentum teres or ligament of the head of the femur, which we can see in this picture. This is the fovea, and it originates from the acetabulum and then it terminates at the fovea of the head of the femur. So this ligamentum teres is a small intracapsular ligament. Intracapsular means that it is located inside the joint cavity and inside the capsule. It attaches proximally in the acetabulum, as I already showed you here, and distally in the fovea of the femoral head, which is actually a small round depression in the head of the femur. It becomes taut during adduction, which is moving the leg past the midline, and during lateral rotation when the hip is in a semi-flexed position. It contains blood vessels which are known as the foveal arteries, which supplies the head of the femur as well, but they are not enough, and there needs to be lateral and medial circumflex artery blood supply as well for the integrity of the femoral head and the hip joint. But it is unable to supply enough blood to the head to keep it viable, as I already mentioned, and as we already discussed in the detail in the previous lecture, in which we talk about the medial lateral femoral circumflex arteries, which were actually a branch of the profunda femoris artery. Now, moving on, there's another ligament which is known as the transverse acetabular ligament. It is not an individual ligament in itself, but it is actually a portion or a part of the acetabular labrum, because if we look here, it is actually a horse shape, and at the lower part there is this transverse acetabular ligament which spans the acetabular notch, making it into a sort of a tunnel. So it differs from the acetabular labrum, even though it is actually a part of the labrum, that it has no cartilage cells in its fibers, and it is more of a ligament in its structural composition rather than a cartilage or a fibrocartilage. Moreover, it consists of strong flattened fibers which cross the acetabular notch and convert it into a foramen through which the nutrient vessels enter the hip joint. So that was all about the stability and the ligaments of the hip joint. I hope you learned something new out of it, and watch all the lectures in the database of the sqadia as well. And thank you very much for watching.